health authority response. Kind of grim news in terms of Oregon and the phases of reopening. Today we had 278 new positive cases announced, and that's the highest single day total since the pandemic began here in Oregon. That brings us to almost 6,100 cases in the state and 182 deaths. Yamhill has 94 cases and has had 8 deaths and has done about 5,000 tests in Yamhill County. The high numbers, the numbers have been going up for about 7 or 8 days now and have raised enough concern that last Friday the governor did a media conference and put all phases of reopening on pause. We're in various phases of reopening. Multnomah County was prepared to be in phase 1. Most counties in Oregon are in phase 2, but this means that no one can progress until we've got a better handle and start to see the numbers going in the opposite direction. A lot of this has been driven by large outbreaks. You may have heard about Lincoln County and an outbreak that started about a week ago in terms of positive tests from Pacific Seafood and the employees in that environment. They now have about 150 cases from that one employer. And then there have been other employers in Newport and Lincoln City that have identified additional cases within their own employees. So OHA is defining a workplace outbreak as any workplace that is common to 5 or more cases and employs 30 or more people. So our large numbers are coming from that. In the past 48 hours, we've seen really large numbers from a church, the Lighthouse United Pentecostal Church in La Grande, Oregon, in Union County. As of Sunday, Union County had 22 cases. On Monday, they had 99 additional new cases. And then today, they had 119 additional new cases, most of them tied back to this single church who was continuing to have large-scale meetings when that wasn't appropriate to the phases that the governor had put in place. So we're really working hard, and counties and local public health are really working hard to try and reverse the dramatic upswing we've seen in the past week here in Oregon. A couple of other things. The governor announced yesterday that there is a new initiative to test every resident and every staff person in a long-term care facility. Those tests will begin now and probably take until September to complete all across the state. Once that initial testing is done and the appropriate actions taken, then there are going to be Oregon rules, statute change to require that the long-term care facilities do continual testing of residents and staff. Some of our highest numbers of deaths have come from long-term care facilities, and that's true here in Oregon and true across the state. And then also last week, the governor did a press conference and announced, along with the Oregon Department of Education, the blueprint for reopening for schools in the fall. And this gets really, really complicated. Each individual school and then school districts will need to submit a plan about how they're going to safely distance students from one another, safely transport. So that means an average school bus will only be able to carry about a third as many children as they do now, which means multiple trips. When you think about children or youth entering and exiting the school, there's a lot of congregation and people close together, so there will need to be phased arrival and departure time. Students, it's recommended that they not change classes, that you keep a cohort of students in one place together. and figure out how you deliver the curriculum to them without them moving from class to class to decrease the mingling that occurs in the hall and the chance for transmission. And then the last thing has to do with school lunch, right? And no eating in the cafeteria, no school breakfast in the cafeteria, probably an arrangement where students eat as a cohort in their classroom to avoid, again, many of them mixing together. And then finally, the blueprints that they put forward will have to have stipulations for how a school will revert to distance learning should there be outbreaks or increasing disease rates in a school or in a particular district. So these are all really complicated, challenging questions and problems to tackle. I appreciated Emily talking about this grant for community-based organizations. So with every case, we've talked about contact tracing and how important that task is. These community-based organization grants are intended to provide money to support organizations with an equity focus that are at the ground level to help take care of people's needs during isolation or quarantine. So if you're a positive COVID case, you need to isolate for 10 days after your symptoms end, or 10 days if you have no symptoms, you can be free from isolation. That means separating yourself from family and any contact with anyone else. And if you can't do that in your home, which we know a lot of people can't, local public health and community-based organizations will be finding places to put people, usually in a hotel, and arrange to wrap around support to help keep them there. And that may mean childcare, it may mean delivering them food and bringing their medications to them, and, you know, supporting their behavioral health needs or their other needs, medical needs, while they're in that setting. Likewise, if you're a contact to a positive case, you will need to quarantine for 10 days and similar kind of restrictions. And if people can't do that themselves, they don't have the resources to do that, there needs to be the systems at the community level that can help them be successful with that. That's how we stop the spread, is by identifying the contacts and then safely isolating or quarantining the individuals to keep them from transmitting what they may have or what we know they have to other people. So these CBO organizations are a big piece of that, and are tied really tightly into Oregon's approach to equity here, with supporting people in local communities. So I think that's a lot to cram in just a couple of minutes, and I'll turn time over to anyone who might have questions, or to the next person, to Ruby or others, to present what they have.
Thanks, Joelle. I don't see any questions coming through the comments or anything. If you want to drop off and keep driving and stay safe, I encourage you to do that. I really appreciate you taking the time today, Joelle.
Thank you.
Okay, so I think I'm going to have our non-staff members go first. So you can drop off too. Jeff, do you mind giving a little update on the board meeting? I can pull up the executive brief if that would be helpful.
Actually, the meeting itself, the bulk of the meeting was an executive session where Seamus and a couple of others talked about the draft strategic plan. And that basically took about an hour and a half of the 2-hour meeting. But just a couple of other quick things. Alexis, Clay, and Jessica were approved by the board formally to be members of the CAC. And the board has this is a new requirement for CCO 2.0 to have a compliance committee at each CCO. And the CCO has filled all of the spaces but the board positions. And I just wanted to note that Gary Dawson volunteered to be one of the board members on the compliance committee. And that's really it. I don't have anything else.
Okay, well, I appreciate you giving that update. I think that we'll be hearing more in the next couple months about the strategic planning process for the company. It's time. It's been 5 years, and so that'll be some exciting updates. So, Jeff, it's 7:25. We didn't quite do it, but
No.
If you want to go ahead and drop off and be with your family, we'll just record the rest of it and we'll check in a week or two.
Do you want me to talk about the handbook review?
Oh, sure. Yeah, we had other agenda items. So, yeah, if you want to talk a little bit about the handbook review, that would be great.
So I brought this idea from being on the CAC in Central Oregon, where the CAC took a section of the member handbook each month and reviewed it and gave feedback to the CCO on thoughts about how to improve the member handbook. And I think this is really a valuable thing. I think there are three main important parts about this. One is that reading the member handbook is an educational experience for the members of the CAC to really find out what's going on in the CCO. Another reason for doing it is to help the CCO, or kind of backstop the CCO staff who writes the member handbook, to just, have another perspective on it. And the last thing is, it's a really good opportunity for CAC advocacy for the members to be sure that the member handbook is complete and says the right things. So what I would suggest is that there are about 60 pages in the member handbook, and we could chop it up into 10-page sections that we would review each month and have a short period in our meetings to talk about changes that we suggest and get those changes back to Emily so she could get them back to the staff. And we could get through the whole handbook in the next 6 months. So that's my suggestion. Emily, but I have looked at it on the website, and because of the color of my hair, I still work best with hard copy. Could you get, under the current circumstances, copies of the physical member handbook out to the board member or the CAC members?
Yes, we have so many copies, and I would be happy to mail those.
Great.
So for this, I am going to add an action item that I will ask CAC members if this is something they're interested in doing.
Yes.
Whether they want a hard copy or an electronic version. And I think that we could go ahead and send out the first section to people before the next meeting. And if people don't have time, that's fine. We'll have a little discussion about it at the meeting. And if there are changes that people feel passionate about, we'll go ahead and record those and keep moving forward.
And I think, the first section could be that introductory section, which is only about 5 pages long.
Mhm.
And that'd be a good way to get started.
Perfect. Okay. Was there anything else, Jeff, that you wanted to make sure to share?
Nope, that's it.
Okay. Well, it's up to you if you want to stay. I think, Dee Dee, if you want to share really quick about the handbook review process, or I'm reading the wrong thing, about CAC recruitment materials, we can have that on the record.
Okay, so Emily and I have been working on some outreach campaign language and some campaign material for recruitment for the CAC. We have recorded some language. Do you want me to just read it, what we have, Emily? Okay.
Yeah, that sounds great.
So we are putting together flyers in different forms of media. Some of the language corresponds to different types of the media that we will be using. Some of the outreach campaign language that we have so far is, are you an OHP, or excuse me, are you on OHP? Show up and be heard. The next one is real people meet once a month to talk about the issues they care about. Join us. The next one is trying to find ways to make a difference. More than 1/4 of the people living in Yamhill County are on OHP. Changes to the YCCO plan, or excuse me, health plan affect everybody. The next one is we help you shape your health. Come and make your opinion count. The next one is, are you an Oregon Health Plan member? We need you. The next one is, we need you. Help us improve your community's health. You can make a difference by joining your CAC program. And that's about all we have right now. We are definitely open to any ideas or language anybody else might have or recommend.
Dee Dee also created some really beautiful flyers, and we will be taking any additional requests for language or strategies, and we'll be sharing those flyers at the next CAC meeting. Okay, thanks, Dee Dee. I really appreciate you, and
Thank you.
your flyers are so lovely.
Thank you.
Okay, last one, Ruby. Do you have any early learning updates?
Yes, I have a few that I'll try to go really quickly. First off, Good 360,
Yeah.
we went at the end of May and collected some items. We got toilet paper, Gatorade packets, napkins, and we gave that to Champion Team for their office use since they're open. We also got some planter kits that we gave out to West Valley Community Campus in Willamina, since they do Friday free activity kits for families. Providence grant, we've used up $500, but we have a total of $4,000 pending in requests. So we have a little bit over $16,000 left that can be requested. And then Kinder Kits, we distributed activity packets, construction paper, books, scissors to families in the Dayton, Amity, Sheridan, Willamina, and YC areas to prep kiddos for kindergarten this upcoming school year. We're also working on Ready for Kindergarten workshops. We're hoping to have a date sometime in July, and those workshops are for parents to prep their kiddos for kindergarten. It says they do targets age-level learning goals. They do training, ways to play with a purpose, and they have tools, take-home materials, and toys to make learning at home fun, easy, and effective. So those are for any parents with kiddos entering kindergarten next year. Be on the lookout for that, and once we have a date, I'll let you all know. And then last but not least, we just sent out an RFP, a request for proposals for, and I just lost the document, for our Family Core home visiting program. And the proposals we are seeking are for the implementation of a public relations campaign to normalize and to promote home visiting throughout Yamhill County. So we're working on that. We released it on Monday, and the deadline for applications is July 31st. And then we're hoping to give notice of awards by August 17th. And those are all the updates I have.
Unmute yourself, Emily. Awesome. Thank you so much, Ruby. I appreciate hearing all those updates. The Early Learning Hub has been doing a lot. I'm really impressed, and I didn't know a lot of those things. So thanks for sharing. Okay, 7:35. If you all want to drop off, I really appreciate you taking a little longer today and sticking around. And I will connect with all of you in the future.
Thank you.
Thank you. Good night.
Bye, Emily.
Bye.
Bye, everybody.
Okay, so last part of the presentation is on health-related services. So this is just an informational portion of the meeting to educate this group about health-related services and what those terms mean and what that funding can be. The Community Advisory Council is one of the bodies that is responsible for giving feedback on where this funding goes. And so hearing those terms, getting familiar with them is important to making sure that we're being good stewards of these funds. So let's see. I want to make sure this is showing up correctly. Let's try one more time. There we go. Okay. Slow internet problems. Okay, trying again. So health-related services are a line of funding that CCOs are required to recognize and to report on. And essentially, there are two pieces of funding that fall under the category of health-related services. So that's the Community Benefit Initiative and flexible services. They're also called flex funds sometimes. Their commonality is that neither of those pieces of funding can be used to pay for a covered benefit. And so health-related service dollars are dollars that are spent on things that would not otherwise be covered by OHP, but are determined to have a positive impact on people's or individuals' health. So the two funding streams are Community Benefit Initiative and Flex Services. And the main difference is that one is for community impact and one must be for individuals. So for the Flex Services, those are things that are tied to an individual OHP members' care plan. So their doctor says, hey, this person is taking medications for asthma, but the home that they're living in doesn't have a very good filtration system. And so their condition is being exacerbated by the environment that they're in. Changing something about the air somebody is breathing is not a covered benefit, but we know that it's going to improve their health. And so purchasing an air filter that they can plug into their wall could be considered a flex service. Other examples are things like there are certain compression socks that aren't covered as durable medical equipment and aren't a benefit. And so purchasing those to keep people's circulation better if they're bedridden, if they have diabetes, there are certain things where that will impact their health positively, but would not be covered by the plan. One of my favorite stories is that there was a client who had some sensory issues and needed to have some kind of fidget toy or other kind of distractions in order to function most successfully. And so the community health worker team worked together and purchased an exercise ball so that this individual could bounce on this exercise ball. They had been previously kind of disruptive for the neighbors with a lot of kind of stimming activities, self-stimulation activities. And this exercise ball was something that was quiet, that added to the kind of exercise and physical activity for this individual's life, and also enabled them to engage in healthy stimming activities as opposed to some that could be more self-harming. And so that purchase, very kind of small expense, not covered by Medicaid per se, was able to improve the quality of life of this individual. Switching over to the community benefit initiative, these are funds that can be used for helping to make communities healthier as a whole. And so for flex funds, we're required to tie them to that OHP number. For community benefit initiative, we're not. There needs to be a demonstration that it's an activity that is proven to some degree to improve health, and that the majority of the people benefiting from that service would be OHP members, but they don't have to be. And this is really something that I think is at the core of the Community Advisory Council's work, is acknowledging that improving the health of YCCO members is going to bolster the health of the community, and at the same time, investing in community programs is going to benefit our members in really tangible ways. So some of the examples are things like park investments, making sure that especially those communities that don't have access to gyms nearby or affordable fitness classes or exercise opportunities, that don't have safe places to walk, are able to access green space and access exercise, both of which we know make people healthier overall. Other things, safe routes to schools, making sure that CCOs are partnering with transportation organizations, ensuring that kiddos are, being taken care of and have access to the things that they need. And then the last one is things like self-management classes. So I want to call out, this is another good example or kind of highlight of how the CBI, the Community Benefit Initiative, is different from the flex services. So CBI might be used to pay for self-management classes, which are things like diabetes self-management. That's an evidence-based course that individuals attend as a group. They build this group dynamic, they work with a trained instructor, and there's a lot of evidence that these programs as a whole can improve health for anybody for whom they're applicable. So the CBI funds can pay for the whole class. We actually are funding some self-management through Virginia Garcia. And we know that the majority of the people will be our members, but we also know that this class is going to be effective for anybody who takes it and completes it. On the other side, flex services might pay for one individual for whom yoga might be part of their care plan. So currently we're offering yoga classes for individuals who are pregnant and would really benefit from something to increase their activity levels, especially people who have a lot of anxiety or depression or a lot of concerns about their pregnancy. Yoga is something that is evidence-based, especially for certain individuals. And so we could pay for a yoga class using CBI, but it's a little trickier to tie that to direct health benefits for a specific need. Whereas an individual for whom yoga is going to have a very direct benefit on their health, if that person is identified, we can pay for classes for that individual as part of their care plan. So that's kind of an example. It's a little gray, but that's how we delineate that CBI, a whole class versus flex funds, one class for one individual as part of a care plan. Okay. The other piece of funding that I wanted to talk about is called the SHARE initiative. So this is supporting health for all through reinvestment. And this is something that isn't going to roll out until 2021, but I imagine that we're going to be hearing more and more about this as guidance comes out and as we really start to determine kind of how ready we are for this model. So at its core, the SHARE initiative is saying that CCOs must reinvest a certain percentage of their revenue into the community for things related to social determinants of health and equity. This is something we already do. Our Community Prevention and Wellness Fund is something that especially in contracts with other agencies, we say 1% of our contract with you is actually going to be funneled back into the community as part of our partnership. And so YCCO has allocated a certain percentage of its current revenue to invest in those CPW funds. The SHARE initiative will essentially require us to ensure that we're being really intentional about those kinds of investments and that they are aligning with what OHA is looking for. So OHA is looking for things addressing social determinants of health. There are a lot of definitions for SDOH, but OHA's specifically is work that includes neighborhood and built environment, economic stability, education, and social and community health. It can also address and should address health disparities. So the ways in which different communities and populations experience worse health because of the demographic that they are a part of. We see a lot of disparities between urban and rural in Oregon. That kind of lack of access to services really shows up. We also see a lot of racial disparities based on the language somebody speaks. And so projects that really aim to address that, especially through addressing things like neighborhood and education and stability. Things like transportation can really come in when we're talking about disparities. And so we don't know what those programs are going to be. We don't know precisely how much will need to be invested, but that's something that we're going to be hearing a lot more about. And so this group is going to have a say in where these funds go. And so I want to make sure that these are familiar terms. So those are the pieces of funding and the terms for them that are going to be coming up over the next couple months and over the next year. And I'm sure if there are questions, I can field them in other ways. Thank you for listening.